Hello and welcome to the Iowa Medical Society's 2026 Physician Day on the Hill pre-briefing webinar. I want to start by thanking each of you for registering for this very important event to advocate on behalf of Iowa physicians. My name is Seth Brown and I'm the Director of Government Relations with the Iowa Medical Society. I lead IMS's advocacy efforts at the Capitol, and today I will walk you through some of the helpful information to be aware of before you join us at the State House on February 17th. To begin, I want to give a brief overview of the political landscape and provide context about what happened last session as we're looking into the 2026 session. Last session, we had an extremely active session. We had a record number of proposals considered at an extremely rapid pace. The total number of bills introduced was well over 2,300. This was a record, and although that is a lot that was introduced, we did see a significant winnowing down of bills, with only 170 ultimately signed into law. While there was a lot of uncertainty throughout the process, especially in the healthcare space, we did see quite a few very major successes. All three of IMS's legislative priorities passed. That was increasing residency slot funding, increasing loan repayment funding, and passing prior auth reform. We also played significant defense and prevented a number of bills from passing, and all of the bills that we were registered against did not advance and were not signed into law. Despite the high volume and the uncertainty, as I mentioned, we had a very successful year. And as we look into this session, we've already seen a record number of new bills introduced. And this requires us to spend our political capital in a certain way as we play defense against some carryover bills, but also new bill proposals. Next, and I'll expand on this a little more the day of, but I want to provide an overview of the legislative makeup for a little bit of context. This is who we will be working with and who we work with on a day-to-day basis at the State House. We are currently in a Republican supermajority in the House with 67 Republicans and 33 Democrats. We do have two new familiar faces in leadership with Majority Leader Representative Bobby Kaufman from Wilton, Iowa, leading the Republicans, and also a new Minority Leader, Representative Brian Meyer from Des Moines, leading the Democratic Party. On the Senate side, we also have a significant Republican majority with 33 Republicans and 17 Democrats, but they do not have a supermajority. One new face to be aware of is Senate Majority Leader Mike Klimisch from Spillville, who was last year's Health and Human Services Committee Chair. When we were looking at some of the top issues in the State House this session, we're hearing a lot about property tax, eminent domain for carbon capture pipeline, but also healthcare more broadly. A significant issue that we will need to address by the end of session is the state Medicaid budget. Based on projections released over the interim, the state Medicaid program projects $76 million deficit for fiscal year 2026, increasing to a $180 million deficit for fiscal year 2027. Couple this with some of the cuts under HR 1, the One Big Beautiful Bill, passed at the federal level. I think it's really, really important that we prioritize Medicaid funding and also payment reform in the commercial space as well. So this will be a significant part of PDOTH, and we'll talk about that a little bit more as we go along. Next, I want to cover IMS's 2026 legislative priorities. This is a list of the 2026 priorities recommended by our Committee on Legislation and approved by our Board of Directors. The top priority is expanding the physician workforce. That continues to be the top of our list. Namely, we want to increase physician reimbursement to make Iowa a competitive practice environment. In addition to fair payment, we also seek to reduce administrative burdens and enhance cancer care. In the Republican majorities, reducing administrative burdens is a significant priority and something that they want to help with. And knowing the current state of cancer rates in the state of Iowa, that is also a huge highlight that we are playing a part in. I'll go on to cover specific bills later on in this presentation and even more the day of, but I did want to provide an overview of what we are prioritizing during session and on Physician Day on the Hill. Next, I'll provide a brief update of what has happened so far this session and some things to know and some key dates. For the 2026 session, the first day was January 12th, so we are several weeks into session. The last day is scheduled for April 12th, and that doesn't mean it's a hard deadline. That's just when per diem for legislators run out, and we expect that it will probably go beyond. A couple notable dates to be aware of. Our Physician Day on the Hill is February 17th. This is within the funnel week, the first funnel week. The funnel deadline is February 20th, the Friday of this week. We expect this to be an extremely busy week, and we intentionally put Physician Day on the Hill during this week to try to impact key proposals that are being considered by the legislature. The funnel deadline is a procedural mechanism that's meant to winnow down bills that will be prioritized in the long run. You essentially have to get a bill through a certain part of the process for it to stay in contention and be in consideration for final passage. We're prioritizing our bills that we want to get across the line this week, but we're also trying to stop proposals that are more problematic that we want to prevent from passing the funnel. Since the first day of session, we have seen over 100 healthcare specific bills introduced. This is far from a comprehensive list of bills that we are engaging on, but these are a few of the bills that we find to be most notable and that we will likely talk about coming into Physician Day on the Hill and day of. Our top priority, which doesn't have a bill number as of now, because we do appropriations at the end of session, but we do want to have discussions about physician reimbursement under Medicaid. As I mentioned, we really want to ensure that we are keeping up with inflation and having a competitive practice environment with our surrounding states. Another bill, and one of our few affirmative bills that we proposed this session, are Senate Study Bill 3081 and House Study Bill 650. These have to do with physician licensure, and we support these bills. These bills will update Iowa's licensing process for physicians. It allows applicants to use a designee to fill out that license application, and it requires licensure renewal every 3 years instead of the current 2-year renewal cycle. It also requires the Board of Medicine to notify applicants within 45 calendar days of receiving their application materials and explaining specific reasons for delay if they exist, but also creating a hard deadline of 75 days for the Board of Medicine to make a determination once all necessary documentation is provided. We're really seeking to get at administrative burdens in the licensure process, and these are a few small changes that we feel like will help in that process. Next bill is Senate Study Bill 3118. This is an insurance reform bill that we are supporting with several other healthcare groups. This bill will remove prior auth requirements for cancer screening. It also requires clinical peer-to-peer review for prior authorization determinations, and it sets audit timelines and several other reforms in the insurance space. This is a great bill that we expect to have significant pushback from insurers on, but knowing the current state of insurance competitiveness and also reimbursement in the state, this is a really important one that we want to make sure we're having conversations on and supporting. We also have a couple of bills that we expect that we are playing defense on that we're registered against. We will play it by ear as we approach Physician Day on the Hill to see what develops and what we need to prioritize. But two bills we're tracking as of now are House File 2171, which would eliminate school vaccine entry requirements, and then Senate Study Bill 3115 and House Study Bill 704, which have to do with medication abortion restrictions. We oppose these two bills. We will update the group as we go along to see what needs to be prioritized based on conversations we've had prior. But I do want to make everybody aware of some of those. There are several other vaccine-related bills that are in consideration. We are having active conversations on that, and we will be figuring out which ones need to be prioritized day up. Next, I want to run through some of the logistics of Physician Day on the Hill. To start, if you are coming from Eastern Iowa, the Iowa City area, we do have the option to ride the bus from Coralville. That bus will leave Coral Ridge Mall outside of the Dillards at 9:15 and depart for IMS headquarters. Physician Day on the Hill programming will start at 11:15 with registration and a free lunch. We'll then have welcome and introductory comments at 11:45. After that, we'll get right into the legislative briefing, and I'll provide more information on some of the information that I provided today, and make sure that you feel comfortable talking to legislators throughout that process. After the legislative briefing, we'll kick off a lawmaker panel discussion with some key lawmakers that are actively involved in the proposals that we are focusing on, both affirmative bills and also bills we are opposing. At 1:30, after the panel discussion concludes, we will depart for the Capitol building. Feel free to either walk or drive over there, depending on how the weather is. There is parking all around the Capitol, and we'll give a little bit of time for you to find some parking spot and get through security in the cafeteria level. I'll provide more information about how to get into the Capitol and how to have those conversations with legislators in a moment. We'll actually kick off the Hill visits around 2 p.m. And we encourage you to email your legislators ahead of time, get in contact with them and let them know you'll be there February 17th from 2 to about 3:45 p.m. And that you'd like to talk with them. The bus to head back to Coralville, departing the state capitol, will leave at 3:45 and get you back by dinner time. So it should be a quick and efficient process. And if you have questions about the agenda, feel free to email me or anyone on IMS staff. I mentioned that we will have a lawmaker panel. These are several of the key lawmakers that will be speaking with us and engaging during our PDOTH briefing session prior to going over the Capitol. Our confirmed panelists include State Representative Austin Harris from House District 26 in Southern Iowa. He is the House HHS Committee Chair, the Health and Human Services Committee Chair. We also have Representative Dr. Megan Srinivas from House District 30 in Des Moines, who is the Appropriations Committee ranking member. We have Senator Carol Warmy from Senate District 26, which includes parts of Story and Marshall counties. She is also the Senate HHS Committee Chair. And then lastly, we have Senator Sarah Schrum-Garriott from Senate District 14, which includes parts of West Des Moines, Waukee, and Adel. She is the HHS Committee ranking member. While we do have all of these panelists technically confirmed, they do have very busy schedules, so participation is subject to their schedules day of, and we may have to be flexible as we're going through with our panel. But I will be moderating that discussion. We look forward to hearing their perspective on healthcare issues, but also asking questions of them from our members. I want to also just take a moment to encourage everybody, as I mentioned earlier, to email your legislators prior to February 17th and let them know that you'd like to meet with them while you're in town. This is the best way to ensure that they are looking for you day of and that you have an opportunity to speak with your lawmakers. And if you do email them, or if you don't, and if you don't hear from them ahead of time, you can put a note in the day of and request to talk that way. We'll explain a little bit more about the logistics and mechanics of how to do that during our legislative briefing on Tuesday. But I will encourage everybody to email their lawmakers ahead of time. If you don't, we can still try to set up a meeting day of. And now just a few quick notes on the basics of how to have that conversation with legislators the day of. We'll go into this a little more during the legislative briefing, but if you want to practice, these are a few tips that I use when we're having those conversations. Start with a brief introduction. You want to state your name and either your practice site or your school, and then state your purpose. And so anytime I introduce myself, I will say, I am Seth Brown, speaking on behalf of the Iowa Medical Society. I am here to talk to you about prior authorization or workforce, and then you can go into your pitch. So introduction, let them know your practice site, your setting, and if you're a constituent, state your purpose. You can say, I'm here for IMS's Physician Day on the Hill, and then what topic you'd like to talk to them about. Then you can go into providing your background and trying to sell them a little bit on the topic that is in front of you. We will provide talking points. I really encourage you to use those and fall back on those if you get lost in conversation, or if you start to ramble a little bit. Those talking points have been briefed and they do work. But also be sure to include some personal examples if you have experience with the topic at hand. Next, and this is really important, make sure that you actually state a specific request and make that ask. You can use your talking points for this. We will have those included. And you can also provide leave behind materials, but you want to make sure that you actually use the bill number and say, will you support, House Study Bill 123? And then you can wait for their reply. At the end of it, definitely be respectful and always say thank you. Whether it's a good conversation or not, you need to try to keep a level head and keep it as respectful as possible, and end it with thanking them for their service. A few more notes, and I briefly hit on this in the last slide, but try to be concise but also respectful when you're having these conversations. We are having very hot button topics sometimes on issues we're very passionate about, but it is important that we stay respectful. Being combative, being disrespectful is not an effective advocacy tool. So I do want to keep that in mind as we're having those conversations. Also, lean on your talking points. Use the information in there. They have been vetted and we know that they work. They're tailored to the parties that are in the building and the issues that they're tracking. Also, tell your story and try to make it as relatable as possible. Use those personal examples and anecdotes to really make your story come alive. Also, know your specific requests and have that bill number on hand. It's not disrespectful to ask them if they will support the bill. And it's okay to just wait until they provide a response back. So make sure you have that bill number and you make that request. And then lastly, this is very important, try to breathe as you're going along. This can sometimes be tense, but you should go in confidently, knowing that you have all of the healthcare expertise and that this is your area of knowledge. They want the information that you have, so go in confidently and just try to stay relaxed as you're having these conversations. And this will conclude our legislative briefing for Physician Day on the Hill. I want to thank you for taking the time to listen in and talk. If you have any questions ahead of time, feel free to email any IMS staff. Otherwise, I look forward to seeing you the day of on February 17th. This will be a great opportunity to advocate on behalf of physicians, and we appreciate your time and effort. Thank you.